Good morning, everyone. It is 8 a.m., so we will go ahead and get started. Welcome to the Heart Failure Quality Exchange call. My name is Audrey, and I will be your moderator today. Feel free to ask questions throughout the presentation by typing them in the chat box on the right hand of your screen, pressing the microphone at the bottom of your screen, or if you're using audio, press *6 to come off mute. The slides and links to the presentation will be sent out within 1 to 2 weeks from today's presentation. I will now turn over the presentation to Cherie Boxberger, our Senior Director of Quality.
Hey, good morning, everyone, and welcome to the Heart Failure Quality Exchange. Just as a reminder, we have these quarterly, and this is the first one of the quarter. We will also have a similar exchange today at noon Central on Get With the Guidelines Stroke. Tomorrow morning, we'll have the atrial fibrillation quality exchange at 8 a.m. Central. And then at noon, have our Code Blue resuscitation, Get With the Guidelines resuscitation at noon Central. And then on Thursday morning at 8 a.m. Central, we'll have our coronary artery disease, both STEMI and NSTEMI. So if you or your colleagues are interested in any of those, there's still time to register for those after today. So just join us for that. So this will be our agenda today. We have a pretty packed agenda and I think some good resources for you. We'll, of course, be looking at the results from last year. I wanted to do kind of a year-end wrap-up since all the data was in, look at our recognized facilities, and then all of you know that our new platform called IRP, and we'll talk a little more about that, is going to start on July 15th. So right now you guys aren't able to access, well, you can do reporting out of your heart failure module, but you cannot add any data until after July 15th when we change platforms. And then I want to provide a bunch of resources that will send out all the links on the slides, things that you might need related to, especially some really great COVID-19 resources related to heart failure. So we are going to hop in. Don't forget to type in questions, and I don't care if they're just random questions that you want to know about your module or about things that are happening. Just pop those into the question, or you can always take yourself off mute and just hop in. We want this to be interactive. So you know I start with this slide every single quarter and every time I talk to you because this is the point of using a registry such as Get With the Guidelines Heart Failure, is to assure that our patients in our inpatient facilities are actually receiving the treatments that have been scientifically proven to provide assistance in not only mortality, but as it shows on this chart, for reducing readmission. So this isn't new information, but I think it is the foundation of the work that we're doing. Is as the science is created, we want to provide that care to the patients who need it. So you can see that all of these have very high impact on reduction of mortality as well as reduction in hospitalizations. So very important that our patients who are eligible get these. And so I was able, all of the levels for the Southwest region, and remember this data is going to include all hospitals to use Get With the Guidelines Heart Failure for Arkansas, Colorado, Oklahoma, New Mexico, Texas, and Wyoming. So the 6 states of the Southwest region. And actually all of these numbers went up for the whole year over the 3 quarters that we looked at previously. And so with your ACE ARB, ARNI at 95%, they're really important, but we know that ARNI has some extra benefits. So ARNI has gone up. If you recall, those of you who've been with us for a while, I believe was at 10% about 5 or 6 quarters ago, and now the adoption of ARNI 23.4. Evidence-based beta blockers, not just any old beta blocker, but the evidence-based beta blocker, there's only 3 of those, 94%. Continuing to see growth in aldosterone antagonists. It's an old medication, but it has significant impact. And so continuing to eke up there, although only at 54%, it is a class 1 recommendation. So if you haven't looked at that piece of data for your hospitals, please do so. Hydroxynitrate is, yeah?
I'm so sorry to interrupt. Your screen is not showing anymore. I'm not sure if.
Not.
Yeah, and I can't give you presentation privileges either. I'm not sure if your computer, something happened, but let me save PowerPoint presentation real quick.
I'm trying one more time just to see if it pops up. Sorry, everybody. Yay for technology. It's saying connecting, so let me just see if it does it. If it doesn't, Audrey has our slides, and she can help us out. Connecting. It looks like I have good internet, but it's still saying connecting. Well, why don't you pop them up? There's no reason you can't. There's nothing exciting that I can't. I'm going to say stop sharing since it's not doing it anyway. When I see them up there, I think I was on slide 3. Are they showing for you? Because I don't see them yet, but.
It says that I'm sharing PowerPoint presentation. Can anyone else see my slides? Lonnie or Deb?
Hey, Allison, or one of you from the QSI team, would you tell us if you're seeing Audrey's slides?
Lonnie said yes.
I did.
Okay. Something's wrong with me. I can't see. So I'm going to go over to my slides, and I'll just tell you, we are on slide, go ahead and go to slide 4.
Okay, we're there.
Sheree,
All right. Sorry. Yes.
Sheree, we're seeing your the presentation mode though. I mean the where it shows like the current slide and the next slide.
Oh, okay.
Well, now that's Audrey because I'm not on.
Yep.
She says I can't see me.
Is that better?
Yes.
Okay. Thanks, Allison. I appreciate it. Oh, goodness, what is a morning now if you don't have technical difficulties? So I think we're good. Slide 4. Looks good, Allison. I'm going to take that as a yes. All right. So we're heading on down. I was talking about hydralazine nitrate, your CRT. All of these are going up. So you guys are doing fantastic work making sure that the patients that are eligible are getting these therapies. And there are so many. And remember, they
Sorry, guys, 1 second.
Am I back, Audrey?
Yes.
For pity's sake. Okay. Guideline-directed medical therapies. I'm sure you've been on this slide for some time, so you get what it is. Next slide. So for 2019 data, we will be sending out your recognition. So I'm just going to have Audrey just spend like a few seconds on each of these slides because these are 30 recognized sites from the Southwest region who are recognized for heart failure performance. You'll notice as we go through here that we have many target heart failure honor rollees as well as the new type 2 diabetes honor roll. And so I'm so proud of all of the work that the hospitals up here and all of you are doing. Some of you are working super hard and haven't yet reached recognition level, but I'm very excited to see the 30 facilities that we have that have been doing that. So you can expect to receive your recognition packets very soon, in fact, probably at the end of this week. And also, for those of you who are silver and gold, you'll also be listed in the U.S. News and World Report edition, which is the August edition. So congratulations to all of you. You can reach out to your specific director if you need to have your certificate or anything sooner than the end of the week, but we have all of that ready for you. So next, if you recall, next slide, we added the No Diabetes by Heart portion, which is actually the type 2 diabetes honor roll. And next slide, with the purpose of doing that is to really, there's this connection. Diabetes is such a risk factor for heart failure and stroke. And so we want to incorporate that into the work that we're doing on heart failure. And as opposed to some of our diagnosis areas, that are all grouped together, these heart failure patients are all over your hospital. So next slide, we're happy today to have and I'm sorry that it put our logo on your slide there, Yvonne, but Yvonne Harris from DHR Health, or Doctors Hospital Renaissance in the Rio Grande Valley, one of our type 2 diabetes honor roll recognized facilities. She was willing to come on today and tell us what the special things they did, because for those of you who haven't done this yet, you're keeping track that all your heart failure patients have, that they've been checked for diabetes, that they are being referred properly for diabetes, and that they're on the appropriate treatment and making that transition. So Yvonne, you can, I don't see, are you on computer? If you're on computer, is that you?
Hi, good morning. Can you hear me?
Yep, we can hear you. Just jump in.
All right, good morning. Thank you so much for inviting us to just go over a few of our items for the target heart failure. I did want to mention we did have a very proactive coordinator. She did recently leave the facility. I do have a new coordinator up and coming within the next couple of weeks, so we definitely don't want to fall off the track with our AAHA program. But to help us meet our overall heart failure and the type 2 diabetes, the new measures, I just wanted to highlight that we do have disease-specific certifications. So we do have another coordinator that specifically looks at diabetes for another accreditation program. So we do participate as well with that. And with our heart failure, we do have physician champions or chairs for our disease-specific programs. So they do meet monthly and or quarterly, depending on the needs of the program. And then again, as you mentioned, for decreasing risk factors and as well as decreasing mortality, we do follow the guideline-driven standardized order sets for our heart failure as well as diabetic patients. So I think utilizing the standardized order sets and following the guidelines, building those into the order sets has really helped meet the measures. For ongoing staff education, we do provide onboarding education at time of hire for the new nurses to review what our accreditation programs and certification programs, what we need to be meeting to qualify for those programs. And then as well with concurrent rounds, just providing the real-time reminders and education on the measures. For our concurrent chart reviews, so the coordinator kind of goes through the daily patients that are in the hospital with heart failure and ensuring that we're in real time meeting the measures. So she had added the diabetes focus to her concurrent rounds. And so again, as well, calling the nurses or rounding on the units with the nurses to remind them of what the measures are. And then at DHR, we do have a big focus on quality. So like I mentioned, we do have the multidisciplinary subcommittees that meet. So again, with the physician and unit champions leadership, we do report up through quality monthly. And then a couple items that we have been working on to help improve and streamline our overall process and help us ensure continuing to meet the measures. Since we do have multiple people working on kind of the same measures, working to decrease duplication in the workflow, and anything that we can use technology-wise to help decrease the manual abstractions and the manual work are things that we're looking into. So again, that goes with the documentation, trying to work with our IT team, our electronic health record team on making the documentation for heart failure and diabetes kind of talk to each other, so that if you're triggered to document on one, that you would also be reminded to document on the other if the patient would also have that diagnosis. And that's pretty much what all I had thought of for today.
And so did you do specialized education or was it kind of just as the coordinator went, or did you have overall hospital education in these departments for diabetes to kind of bring those areas up to date on current?
For the diabetes, that's one of our other accredited programs, and that one is actually accredited through the Joint Commission. So that program is already providing onboarding education at time of hire for new nurses, and then we do have annual education that we provide as assigned on a rotating basis, and then the coordinator for diabetes as well does concurrent rounds and real-time education with the staff.
So you just tied those two together. That's cool. And are you guys currently using an uploader in the PMT, or are you completely manual abstracting?
We manually abstract into AAHA, but some of the items do cross over from the upload.
Okay, and so we'll need to talk to you. Maybe there's a way for us to help with that in the new IRP, but we can talk about that when Christina comes on. You know, we're glad to assist. We've got some new tools in the new IRP. Audrey, what other questions? Do we have other questions that anybody's typed in, perhaps?
We have no questions in the chat box.
I have a question. Can y'all hear me?
Okay, go ahead.
I would like to know, when you first began this program, or I guess onboarding of a new heart failure coordinator, what were the biggest areas of need that you noticed, or that you realized once you started doing chart review and I guess in looking at the abstraction data?
I think in general the biggest barrier is the time for the abstractions, as well as the catch-up time on a Monday when, you know, reviewing patient cases from over the weekend and trying to catch up on reviewing those records. More of our time is spent preventing fallout, so trying to work on reviewing cases in real time and touching base with the nurses in real time. So then we're not really here on the weekends to do that.
Awesome. And I guess one follow-up question I might have is, what measures in the early days of the program, what measures did you feel like you struggled with, and what were you guys doing that you felt like helped a lot to really help you achieve the 85% on those measures, if there were any?
I think the main challenge, I think, would still be and we're right there, is meeting the follow-up appointment for 7 days. But again, that is one of the focus items for diabetes as well. So like right now we do have kind of like 2 sets of eyes looking at those patients, making sure they have follow-up appointments for their disease-specific cares. But right now we're kind of looking into, we want to make sure we're abstracting correctly and following the guidelines. But I know right now the follow-up appointments are a bit of a challenge. More providers are going to telehealth or unable to set the appointments prior to discharge at this time.
Yeah, that's for sure a challenge across the board. Hey, I did want to give anybody else on the line who has done some special things. I see on the list we've got several of you that are recognized on the type 2 diabetes. Anyone else want to share *6 or come off mute what you've done to combine these diagnostic areas so that they're getting the best care? And you can also type it in so that we can reach out to you later just to learn what you're doing more. Kim, are you guys doing anything special at UC Health, or, I'm sorry, I'm looking down the list here, people I know who are recognized. All right, well, we'll move on, but if you do have things that you could share with your colleagues, let's do that. All right, so July 15th, we're moving to IRP. So I wanted you to be able to ask your questions in kind of a small forum. We've had several very large educational forums, which have been fantastic, but wanted to give the Southwest hospitals an opportunity to get direct questions that you might have. So Christina Sturzing is with us, and Christina works with our health IT group under quality here at the American Heart Association. And I think she's going to be sharing her screen. Now, some of this will be repetitive, but we are so afraid that people are going to find out that their system doesn't work and they don't know what happened. So, Christina, I'm going to turn it over to you to give us an update on what these folks can expect over the next month or two.
Hey, Christina, we can see your screen.
Oh, we can't hear you, but you're probably getting organized.
Okay, sorry. No, I was having a hard time finding the mute and unmute button, so I apologize for that. Good morning, everybody. You can hear me now, right, Sheree?
Loud and clear, sounds good.
Okay, great. Thank you. So as Sheree mentioned, we are going live with the new and improved heart failure registry that will be called IRP, which stands for IQVIA Registry Platform. And some of you probably have heard this information or seen it via email, so it will be somewhat repetitive, and if anyone wants to ask any questions, feel free to interrupt and ask those questions. And we're really excited to bring this and roll this out to everyone because we, over a period of years, have listened to all of your input and taken your suggestions and kind of reformatted that and started up this new platform where we'll be able to bring some of that technology and those enhancements to you. So, just as a reminder, we are currently in the read-only period for the PMT. So on July 29th, we transitioned to that read-only period where now you will be able to still run reports and view your data, but you'll no longer be able to enter records or do any uploads. But on July 15th, you'll be able to begin that new data entry and uploads into the IRP. So,
hey, Christina.
Yeah.
Do you mind putting your slideshow on presenter view on the bottom right? Great.
Okay. Yep.
Thank you so much.
Yes, thanks for reminding me about that. Let me Go to my slide. Okay, so on July 15th, you'll be able to log in to this new URL, and you may want to go ahead and check with your IT department that this URL isn't blocked. If if you're a CAD user or a COVID registry user, then you've already gone to this website. It's the same one, but just for a smooth transition, you may want to check on this, or just try going to it now. You won't be able to log in, but just make sure you don't have a firewall or some other barrier to get into this site. And if you do, just work with your IT department to allow this site to be brought up on your hospital's network. You'll also receive 2 emails on July 15th with your login information. So they'll say they're from AAHA support. One email will have your username, the other will have your password, and then you just go through your login and setup process. And I recommend that you try to do that even if you don't plan on doing data entry. Try to do that within the first couple of weeks, just so you can establish your new password and set up your challenge questions. And the challenge questions, and I'm sure everyone's kind of familiar with this sort of thing, but they allow you to retrieve your password if you ever forget it, which saves you a little bit of time, so you don't have to call the help desk to retrieve that. You can just go in and answer your challenge questions, and a new email is sent to you pretty immediately, and for you to reset. So it's a lot faster than having to call the help desk. If for some reason you don't receive the emails on July 15th, contact the help desk. It's still the same contact information, same email, same phone number. If you don't receive that, then they can set you up with that. And then let's go into, I'm not sure how much time I have, so if I'm taking too long, let me know, Sheree.
No, go ahead and give us a nice overview, another 10 minutes or so is fine.
Okay. So I've also wanted to give you all a quick look at IRP if you have not seen it before. So this is a demonstration site, no real data is in here, but we loaded some test records so you all could see some full dashboards and see how these are generating. So we are really excited to bring these dashboards to you. And actually, I believe the idea for several of these dashboards came from Cheree's region, and they gave us, they'd been using some reports, I think with all of you on a quarterly basis, that helped us come up with these dashboards. So some of this may look a little familiar to you, or at least the concept will. On the left side, you'll see a composite of the achievement, quality, and honor roll measures. And then you'll have this legend that you will be able to go back to the prior 12 months and view each quarter's data. And then there's also a year-to-date bar. So if you're looking for just maybe your recognition data for the current year, you could select this option on the legend and just view that information. So again, on the left side is the composite, but then when you click on any of these composites, on the right, you'll get a breakdown. So I clicked on 2019 quarter 3, this red bar on the left. On the right, you'll get the breakdown for that composite. So each of the 4 achievement measures shows up here, and the percentage of compliance, and also with the line that shows, your target for those recognition levels. So it's really helpful in just an easy, quick view. There's nothing you have to do except log in, and you have a view of these dashboards, and it gives you that nice, quick view of your recognition status. And then the year-to-date bars that I was referencing earlier. So if you, on the legend, you'll have this, I don't know what you call this, magenta maybe, color year-to-date. And if you click on that, it will show you your recognition in the different recognition levels. On the left, the composite, and then on the right, you will look at the breakdown. This is a lot of information on the right side, so if you just want to view achievement, you would just click on that bar and that would show up. You can also expand the view, which makes it a lot easier to read. And if you are interested in, taking a quick snapshot of this and putting it in a PowerPoint slide or some other document, this is kind of the view that you'd probably prefer. You can just click anywhere to display all the bars again. At this time, we don't have a print function. We are working on that, so to make it easier to put those in PowerPoints, but you can use the print screen button, or if you have a screen snipping tool, like I think snipping tool is a standard program on all computers, at least all computers with Microsoft Suite. And you can just snip this tool and put it in a PowerPoint slide very quickly. So it's kind of a couple extra clicks, but still very simple to put into a PowerPoint slide. But again, we are going to work on that functionality to allow for that easy presentation. So going back to how the dashboard works, if you click on one of the composite bars again, if I scroll to the next bar, it is giving that breakdown. Just like I showed you in the smaller view, this is just the maximized visualization, so it's a lot easier to read. And then you can scroll through all the different widgets within the dashboard to view those. And then to return to the smaller view, you just click on those arrows again, and you can also expand views within the dashboard, resize, hide the legend. There's a lot of really cool functionality here to allow you to kind of get what you're looking for. So this is one of the most exciting things that we're bringing to you, just because of the ease of the functionality, but also just the visual that it gives you, and nice reports to maybe share with your administration or colleagues. Sheree had mentioned the uploader function, and I did want to point that out, and we can kind of, if we have time, come back to that really quickly to show you how easy that is to use. If it's not something that you've used in the past, it may be something of interest for the future. I'm going into reports now, and we have some great reports. So there's a lot of new functionality in the report section that the PMT didn't have. There's a lot more customization you can make to control what your output is. So you're familiar with setting your date parameters. So I'll just pull something from last year, and we'll just do the achievement measure bundle. And one really cool feature is the ability to filter basically by any data element that we collect in the form. So in the PMT, we had some static filters that were pre-programmed for users, and you couldn't really, change those. Whatever was available is what you could work with. But now in IRP, you can select any number of filters. So if you just click in the select variable box, you'll see there's this long list of filters you can select, or you can begin typing, and it kind of starts auto-populating for you. So you can select that as a filter, and then you apply parameters. And then when the report loads, you have all this customization that you can add, or you can just leave it as is. It depends on what your needs are, of course. This may take a while to load because I'm in a test environment right now, and if it takes too long to load, we'll just keep moving. But you'll see you can still select the percentiles here and different display options. But another nice thing about these reports is how instead of having to run multiple versions of the same report to get like your bar graph or case list, It's now all in one report. So I pulled the achievement bundle aggregated data, and so you could just scroll through the different bars to see, I think it's still loading actually, all the different measures and your compliance there. And then if you go to measure details, it will show you the breakdown of each of the measures. And then you can select a line. So I just clicked on this line and then mark values. And then when you go to case list, it's going to show you all the records for the ACE Arbor ARNI measure because that's the one I selected. And then just like in the PMT, when you're in the patient record format report, you can click into a record to view the patient record. You can also do that here. Just click on any of your records and it will open up the form for that record. And this gives you the denominator, exclusion, numerator, and exception criteria. You can sort by any of these columns. You can export. I don't know if you'd really want to do your case list into PDF. I'll show you the bar. So export to PowerPoint. We now have that available. So you click on that and it's going to create a slide with the graph in it. You can also customize a little bit how you want that graph to export. So there's some things you can do on this page to adjust how you want it to look. And then if you wanted to add your filters, you go over to this filter button on the right, and you can then filter just by, if you just wanted to look at your records with qualitative, moderate, or severe dysfunction, you would indicate that in your filters, and then the graph updates as you change your bars, or I'm sorry, your filters. So the patient grid also is excuse me, is an improvement because you can add or remove columns that you find most useful in your patient grid to help you identify cases that may need further review. You can sort by any of the columns here. So just by clicking on the column, it sorts. And then you can also export your records directly from the grid. There's still the data download report, which you may want to use if you're trying to export every record with every data element available. But if you only want to export the patients with the columns available or displayed in your patient grid, then you would just export from here just by clicking that button, and it generates an Excel spreadsheet with those records. So it saves you a little bit of time if that suits your needs. And then let's just take a quick look at a patient record. So you can also play around a little bit with how big you want the patient record form to display. So I minimize this header information just to give it a little bit more space. And then you can click here to minimize the left side navigation. You can also expand this by closing the tabs on the right. So there's a lot more space for you to view the record in one screen. The font's bigger, it's a lot cleaner, easier to read. The other nice feature that we've added is the, we're calling it the show hide functionality. So fields will basically be hidden unless they're needed for the particular patient record. So I'm going to use the Hispanic ethnicity to demonstrate this. So Hispanic ethnicity, I'll say yes, and now you'll see that it's prompting you to answer the select Hispanic origin group. So then you can do that. But if I had selected no, you'll see that the select Hispanic origin group is now hidden because you don't need to answer it. And so it minimizes the amount of clicks or tabs if you're using the tab function, or you know, just whatever, how you're managing your form, it makes it a lot easier to get through the form. And then you can click on this next button at the bottom to scroll through the tabs, or click on the right side to navigate through your tabs. They're not in the PMT, you know, we had the tabs across the top. Now they're on the right side, but you can also just click through the form by clicking next. Another change that will minimize the amount of time it takes to enter records is the updates to the discharge medication. So we've aligned this format across all of our registries as they move to IRP to make it easier for interoperability opportunities, for minimizing the amount of clicks and data entry time. So what we did here was, for the discharge medication, you'll see the ACE prescribed question, for example. It asks you yes, no, or NC. And NC stands for none contraindicated. So if you select none contraindicated, then you'll be prompted to list those contraindications. If you say yes to prescribe, then you can go through and begin selecting medication dosage frequency. And if you select no, then you can just go on to the next medication. So this hopefully saves some time for all of you. We did kind of do a time study where it saved about 20 tab through buttons, or clicks, I mean, which ended up being, you know, at least 10 minutes per record. So you may find that just with your familiarity with the form and data entry that it's faster for you, but we hope that it's creating some quicker data entry for all of you. That pretty much covers the form. Is there, was someone going to talk?
Nope, I was just going to see if Audrey, if anybody typed in, because, you know, this is going to happen in 8 days. It's going to be available. And I'm sure Christina, and I put it on my slides too, about office hours, et cetera, that are going to happen next week and the following week. But type in your questions, and then we'll just do a little more of the next steps. But anything typed in there, Audrey, or you can come off mute and just ask the question, *6 or unclick if you're using computer audio.
Yeah, we have no questions in the chat box yet.
All right. So kind of talk about the office hours, that kind of getting started kit thing, which I think it's called something different, was on the email.
Yeah, I called it the
transition packet.
Yeah.
Yeah.
Let's see here. So this is available to all of you. I could put the link in the chat, actually. Let me do that.
And then, Christina, if you want to share your screen, just make sure you press that on the bottom.
Oh, I'm not sharing anymore. Okay.
There we go.
And for some reason, it's not letting me put it in the chat. So
I've got it in our slides, so don't worry about it. The slides I'm going to send out are there, but we may send that out quicker. We'll probably send out that link right after this instead of waiting for the whole slides. But
okay,
she's showing you what is in there.
Yep. So anybody can access this. Each line represents a different category of resources, and then you can click on the paperclip to view those resources. So the CRFs are available with the IRP updates. The CRF looks similar to how it's formatted for the PMT, but there are a couple new fields in IRP. So, you know, those are highlighted like usual, just like any other PMT release. And then the recordings from the 2 webinars that we hosted are here along with the handouts, so you may want to check those out. There's also a Q&A, and the registration for office hours is here. So starting July 15th through the end of July, we'll offer office hours. The first week, first 3 days, it'll be 3 times a day, and then the following 2 weeks, it will be 2 times a week, or I'm sorry, 2 times a day. and you know, we'll send out additional information at that point, or you'll hear directly from your regions about more training opportunities. The Q&A is a place for you to submit questions, and oh, that's not, sorry, I opened up the wrong link. This is the list of questions that have been asked and the responses. So you may want to scroll through those and see what's been asked, or you can do a Control F and type in a term that you're looking for, or filter by topic category and read through those. Or you can also submit your own question using the submit a question or comment using this form. So this opens up a form that you can fill out and submit, and then I usually respond to these, but occasionally I do send them to the VPs or staff in the regions if it's kind of more programmatic or other question that needs to be sent to them. And then I give them a report out each week of all the questions that has been asked so they can be aware of what's going on. The CSV uploader resources are also listed here. I've been in touch with hopefully all the hospitals that have built their own CSV uploader and talking about the transition. If you don't use a CSV uploader, this is not something you have to do or worry about. I know some people, when they hear this, think this is like something they need to be building. No, no, you don't have to. You can still do manual data entry or however you were doing, or a web service, you know, like Midas, or, you know, you can continue to do that. And everything's kind of the same as far as that goes in the PMT. But if you did want to begin using an uploader, in the PMT, you know, it was a little bit tricky to use that, and you'd probably have to employ an IT resource to begin your uploader. You still probably have to with IRP, but there are a few things you can do that might help you build something on your own. So if you, just one sec, I have to go out and come back in. There's a little bug here.
And if you're interested in doing this while she's finding that, if you can connect your director with whoever your liaison is to your EHR, we can provide the specifications and discuss how big of a list this would be for your hospital. But even if you just uploaded the discharge dates and times, the date of birth, all those dates and time things, and everything else you manually abstracted, you could still save significant time using an uploader.
That's right. Yep. And again, this is a test environment, so they might be working in it. I was going to demonstrate how easy it is to do an upload. Let me try a different site. Just one second.
And the beauty of this, I don't know if any of you have done this, but we used to have, you'd create this file and you'd upload it and you didn't even know what was wrong with it. It would just fail. And so the thing she's going to show you, when you make the file, you can upload it and it tells you exactly what's wrong with the thing you created. And so they can easily be fixed. And we never had that. You were just like guessing sometimes to see if you could get, you weren't really guessing, but it was, this is a nice little wizard that your IT resources, and you can, we're not expecting the nursing staff to be doing this, but your IT folks can help you. And we probably need to stop it there. Why don't you do one real quick? It looks like you got one.
Yeah. So what Sheree was talking about is like if there are any issues, so it will tell you. This mapping tool helps you identify the new fields. So we did change field names. So you can just begin typing and bring up the new field and map it. And then when you correct that, you click submit. All of these instructions are on the that transition packet I showed you. So I know this is going fast. But what Sheree was also talking about, like the identification of what's wrong in the file. So this tells you the specific column or data element that's wrong. So this is race. And then it's going to tell you how many errors exist. There's just one. But it also tells you what row number the error occurs on. So if I go back to my original file and pull up the file, I can go to line 22 and it'll show me exactly what's wrong with it.
And this may not be exciting to you, but if you've gone and asked your IT resources before to help you and they've kind of nixed it, if you tell them there's an integrated wizard with this kind of thing, I would suggest you approach them again, because they'll be like, okay, because we used to have to go and look at the field guide and figure out the name or the title of the field, and all of this is going to save them a ton of time. So if you haven't done that before, make sure and go back again.
And it is so easy that it is something maybe with a little bit of help from an AHA staff person, you could set up like some of those date time fields that Sheree was talking about, or at least just like maybe some demographic information. Because of the mapping tool, you could just build it right in here and it saves it. So that's how easy it is to upload something. If you had a file to upload, and then it also tells you how many records were uploaded and then what's wrong with it if there wasn't a record that made the upload. So yeah, this cool. Could potentially save you a ton of time.
Any questions, Audrey, before we let Christina go and do our last few minutes here?
No questions.
All right. So I'm assuming all of you are ready to go. You're waiting for those AHA supports. I did put the link to the transition packet over in chat. So click on that and save it somewhere, because that is just everything you're going to need to know about what's happening starting next week on the 15th, and who you can ask for what. So click on that and save that somewhere. And keep those questions come in. If you think of something else, I mean, we have access to Christina after this call. We can definitely get back to you with an answer. So thank you so much, Christina. We really appreciate it.
My pleasure. Thanks for having me.
Yeah. Okay, so Audrey, and just show the next page, Audrey. I think this is an overview of what was on that link. You can register for the office hours that are going to start next week. It also has that transition packet. And so when we send out these slides, but I wanted you to have it quicker, and she showed you that. But there's training videos. Christina's creating all sorts of things that it'll just be increasing the number of resources you have. But this is next week when you'll have access to it. So next slide. All right, just a reminder, we're continuing to have great adoption by our skilled nursing facilities and other folks related to post-acute care heart failure certification. Even during this time of horrid stress within our senior centers, within our long-term care centers, we're still seeing adoption and work on the heart failure world. So as those facilities are settling back down, don't forget to share this with your partners, because if they know what they're doing at the post-acute setting, then you're going to have more appropriate referrals, more appropriate transfers, that kind of thing. And next slide. Want to share a few resources as we're wrapping up. I'll go ahead. This will be on the slides. Next slide. And things that are out there. Oh, you may have seen all of the Don't Die of Doubt. We're really continuing to see a decrease. We're getting to the end of it of folks not using 911. So this is just an example of using this tool and to be able to promote it on your social media. Next slide. We still have the beautiful COVID-19 content AHA Compendium. This is from early on, so it doesn't have a ton of things on this page. When you go now, it's just this wonderful resource. Everything from advice as it relates to intubation and other issues, reducing aerosolization from some of our standard processes, things related to CPR. There's actually 3 educational videos related to intubation and airway management, since we have to take extra precaution in that area, but just wonderful resources. So make sure you click the link or you have that link available. We've been telling this in all of our webinars. Next page. And just an update as it relates to COVID-19, this is divided by our AAHA regions. And so this was as of 7/6, so this is brand new information using New York Times Interactive for this, but kind of gives you an idea of the variation that's continuing across our regions, all regions, of course, being seriously impacted by that. And now on to some heart failure specific resources. Next page. Wonderful webinar. When we get the slides out, click on here. It was held on May 27th. Featured Dr. Clyde Yancey, Dr. Salzberg, as well as Jorge Shahod. And this is a fantastic webinar and a toolkit talking about the issues related to heart failure during this time. Also, any of the things that they're watching as they're realizing that it's impacting, causing additional heart failure or impacting existing heart failure. So excellent webinar available at no cost. Next slide. Another webinar, which is available, and these are not the same. So I encourage you that great education. This was put on by our Midwest region on May 14th. So this is you do register now, but you can listen to it currently. So this is not behind, featuring Dr. Nancy Albert, as well as Dr. Sauer and Dr. Vila, related and completely different topics, but very synergistic with the other webinar. Next page. Some great tools that are out. This is the coronavirus, what heart failure patients need to know handout. It's really good, and I think something you might want to use with your current patients. Next slide. This is a frequently asked questions document for persons with heart failure, really emphasizing what to do during quarantine, because of course those patients are going to quarantine longer than, they'll be being extremely careful long term. So this has a link in it to this resource, a nice thing to pass out or email to your current patient. Next page. This is really nice, again, when you're leaving the hospital. Again, just a discharge infographic, I would call it, but that's fairly new. And I think with the photos, sometimes people pay more attention. Talks about what to do immediately, what to do in 7 days, what to do a month after. So an excellent resource that we also provided the link for. Next. And then this is just all the tools and resources. This is mostly for you. I'm not sure, I guess you could use it for patients as well, but this is really the professional side link that gives just all the resources across for you to use with your patients. And you can see the advocacy organizations that came together to put this Take Control of Your Heart Failure resource together. And there is a link for that when we fling this out. Next page. Another providing best practice health strategies. These are COVID suggestions that came out from across the country, things that people have done related to CDC precautions. Something perhaps as you're looking at disaster planning or making sure that in your COVID plan, which we all have now, that these things are there. So just a good resource. Next page. Oh, okay, so that's the end of our resources, but just a reminder that Scientific Sessions is coming up. So lots of resources for you to use with the patient. Any questions or any comments that have come in, Audrey?
No questions.
We really want to know, as when we get to we're counting on getting to the other side of this. We think most of our sites are considering or opening up their heart failure clinics, depending on what the current situation is in your community. Whether there's the discussion to continue using some of the tools. We know that we've gotten pretty good with doing telehealth. So we're interested in what changes have occurred because of this pandemic and which ones you're keeping and things that have done. So don't hesitate to reach out to us. So we have 1 minute to go, but just want to double check in if there's any questions, anything you want to know, *6. We want to be here as we change this software package. Don't be nervous. I think you're going to find it much better. You're going to find that the PMT needed to be improved, and you're going to love the new IRP platform. But any questions? Come off mute, star 6. All right. Well, I am so thankful to work with all of you. I tell you what, and the work that you're doing as it relates to getting these guideline treatments to your patients are amazing. To all of the 30 hospitals who are recognized, congratulations, and be looking for your award kits very shortly. And we will be meeting up again in the next quarter or so, but your director is always available to answer your questions as you have them. So with that, we're straight up 9 o'clock or 8 o'clock at Mountain Time. We will say good day. Thanks, and you can plan on getting these slides in this week or possibly next week so you have all of your links. Thanks so much. Have a great day.